Hey everyone, welcome back to the channel. Today, we re-dive into a topic that affects every single person in the United States. The healthcare system. It's a massive, complex web of doctors, hospitals, insurance companies, and government programs. It can feel overwhelming. But don't worry, we're going to break it down together in a way that's easy to understand. So, grab a coffee, get comfortable, and let's unravel the anatomy of American healthcare. First things first, let's talk about how most people get their health coverage. The majority of Americans under 65 get health insurance through their job. This is called employer-sponsored insurance. Your company usually pays a big chunk of the monthly premium, and you pay the rest. This system started way back during World War II, as a way for employers to attract workers when wages were frozen. It stuck around and became the backbone of how many of us access healthcare. When you use this insurance, you'll still have out-of-pocket costs, which is what you pay before insurance kicks in, and co-payments, a fixed fee for services like a doctor's visit. But what if you don't get insurance through work? Or what if you're over 65? This is where government programs come in. The biggest one is Medicare, which primarily covers people aged 65 and older, as well as some younger people with disabilities. It's funded by payroll taxes that you see taken out of your paycheck. Then there's Medicaid, which is a joint federal and state program that provides health coverage to low-income individuals and families. The eligibility rules for Medicaid can vary a lot from state to state, which adds another layer of complexity to the system. There's also the Children's Health Insurance Program, or CHIP, which covers kids and families who earn too much from Medicaid but can't afford private insurance. Now, let's talk about the Affordable Care Act, often called the ACA. Passed in 2010. The ACA made some huge changes. It created health insurance marketplaces where individuals can shop for plans, often with financial help from the government, to lower the cost. It also expanded Medicaid in many states, allowing more low-income adults to qualify. A major part of the ACA is that it stopped insurance companies from denying coverage to people with pre-existing conditions, like asthma or diabetes. This was a game-changer for millions of Americans who previously couldn't get insured. So, we have employer plans, government programs, and the ACHA. Marketplace. But how do these pieces actually work when you need care? Let's say you get sick. You'll usually see your primary care physician, or PCP. Your PCP is your main doctor who handles routine checkups and common illnesses. If you need more specialized care, your PCP will give you a referral to a specialist. The cost of these visits depends heavily on your insurance plan's network. An in-network doctor has a contract with your insurance company, so you pay less. An out-of-network doctor doesn't, and seeing them can cost you a lot more. This brings us to the big question. Why is U.S. healthcare so expensive? It's a combination of factors. We have high prices for prescription drugs and medical procedures. There's also a lot of administrative overhead from dealing with all the different insurance companies. Plus, we use a fee-for-service model, where doctors and hospitals are paid for each individual service they provide. This can sometimes lead to more tests and treatments than are truly necessary. Like a cardiologist for heart issues or a dermatologist for skin problems, the cost of these visits depends heavily on. The U.S. spends more on healthcare per person than any other developed country, but our health outcomes aren't always the best. It's a paradox that policymakers and experts are constantly trying to solve. Understanding how it works is the first step toward navigating it for yourself and your family. If you found this video helpful, give it a thumbs up and hit that subscribe button for more deep dives into important topics. Thanks for watching, and I'll see you in the next one.